I love to say I told you so. And someone was saying the other day, nobody saw this COVID-19 thing lasting this long. And I thought, well, actually I did. And I found a video from March kind of confirming that, just talking about my feelings. I'll play it for you in a second. But I want to talk COVID-19 for a couple minutes. Coronavirus. I'm not one of those people who thinks it's all a hoax. I'm willing to. I've taken it seriously from the start. Read some medical literature, and I've also just looked at the examples of other countries. Countries like Taiwan, South Korea, Japan, you name it, Vietnam, countries all around the world that took it seriously from the beginning and responded with things like wearing masks, social distancing, and other efforts to stop the virus from taking hold of the population. And I looked at our country and said, oh, we're actually acting in just about the stupidest way you can imagine, as you might expect Americans to do. And I caught this straight from the start, and I kind of predicted things would get out of hand. I'm not one of those people for sure who is an anti-masker. I'm not one of those hoaxers. Now, I'm willing to entertain any conspiracy theories that kind of fit the premise and the reality of the actual facts I see. So, like, for instance, if you want to talk about the origins of the virus itself, hey, I'm game for that. Is it a CIA creation? Sure. Let me hear what you have to say. Did Bill Gates make it? I don't know. He seems to be profiting off of it, and he was getting up to something with Epstein on Zorro Ranch. Who knows what? So is it possible that the origin of COVID-19 is in fact the Epstein kill switch? So Epstein got killed, so this thing got released. I don't know. It's all fun stuff to, not fun, but it's all interesting to entertain conspiracies in that regard. But one thing I've always taken seriously is this virus is here and it's real. And I just want to prove it to you, and because I love to say I told you so. Here's a video I recorded, I believe, in March 18th. We won't watch the whole thing, but let's take a look at this for just a minute. Line at Trader Joe's right now to get in. Just waiting in the car. So I was reading a report, this COVID-19. I don't think it's going away anytime soon. It's the report I was reading. I shared it on my Facebook. You could find it online, but it's according to this report, about 4 million people in the U.S. can die unless we practice quarantining for 14 to 18 months. And what that does is clinical trials have already started on, say, vaccines and treatments, but those trials take about 14 months. So, and they're already skipping safety protocols that you would normally have. They're jumping right to human testing, not testing on animals, which is an extraordinary measure. So you test people for 14 months, make sure the vaccine doesn't kill them, and then it's also going to take a lot of time to actually manufacture this thing and get it out to people. So self-quarantining for 2 weeks isn't going to help all that much if we just go right back out and start spreading the disease again. So we'll have to practice quarantining. And when I get to stores, and I've been to several looking for things that are out of stock, when I get to stores and see lines of people, very few wearing masks, I know that we are not taking this seriously. And it's kind of ridiculous given the scope of the thing. We're talking 4 million people in the U.S., and that's not counting worldwide. That was from March 18th, and I just want to say I told you so. I kind of knew that this was going to take a long time. And I watched as California and other states started easing restrictions, opening up, and I said, well, that's a very stupid thing to do. And I personally made the choice to, remain quarantined as much as possible, limit risks as much as possible. And, that's my take how it's been. You could be an anti-masker if you want. I think that's dumb and pretty inconsiderate, So if you can, even if it's all fake, lies, wearing a mask just a little bit isn't going to infringe on the quality of your life. In the off chance it can save someone else's life, just wear a damn mask, unless you're an inconsiderate prick. But I became interested in this phenomenon now that as things are surging, and LA is a hot spot, kind of as I predicted. I was surprised to find out. I was talking to someone who works at a hospital in the Bay Area, and they said, hey, we're getting shipped a lot of people from LA. And I hadn't heard this, but I did find some articles, some news, overwhelmed Southern California transferring coronavirus patients to Bay Area hospitals. Now they're saying that's coming from Imperial County. I heard Los Angeles. Who knows? It could be both, but hospitals up and down the state are overwhelmed, and Southern California is shipping patients now up to Northern California, the Bay Area, rather. Not good. And I have a coronavirus story, personal story myself. So I started having symptoms on July 4th. I had coughing. I'm still coughing a little bit. And I had experienced dizziness, spells of dizziness, extreme fatigue, which is kind of unusual for me. And also, the strangest sensation is shortness of breath. So I said, hey, the mayor's out there, the governor's out there, everyone's out there saying, go get tested. It's easy to get tested. And you start hitting up these websites, the County of Los Angeles COVID testing sites, where they give you names of all these testing sites. Some of them have phone numbers, most do not. You can click them and, go to try to register to get a test. That's one site. Then I would go down. I start feeling sick on July 4th, and so on Monday, following that, I started saying, okay, I'm gonna go get tested. I have these symptoms. It's kind of weird. So I start going down the list on one site, trying to contact first the places close to me, and then the places not so close to me. You get phone lines that go nowhere. You get hung up on, or leave a message, say they'll call you back. They don't call you back. So I'm like, okay. I find that there's other sites where you can kind of put in that you have symptoms, because they say you have to have symptoms, by the way. It's not just like testing of anyone. And you put them in and save and continue, put all this in. And so there's several sites where you can go to attempt to get tested. I went through all of them I spent almost a full day just trying to get a testing appointment, with no luck, by the way. So I start calling my doctor that night, the next day, seeing if I can go through at that angle of getting a doctor's appointment. By Thursday, I continue trying these, and then I learned the game is there's a few sites where you can kind of register online, and I learned that the game is you have to do it super early, or book it, and then even then if you get online early, they might only have availabilities for tests 3 or 4 days out. So long story short, I spent probably like 15 to 20 hours in the week just in the process of phone calls, emails, trying to get tested. I eventually booked a test for that following Friday. So now almost a full week after I started feeling symptoms. And the test is a drive-through test, and I'm trying to remember where it is. And if you look on this website here, drive-up testing sites, this is another phenomenon I want to talk about. So, and I have a video from when I got tested. I got tested in gosh, now I'm forgetting the name of it. So look at the walk-up sites. That was the list of driving sites. This is the list of walk-up sites. Now, from what I've heard, getting booked at a walk-up site, much harder than getting booked at a drive-up site. And they're kind of concentrated in specific areas, not necessarily near where everyone's at, or the people that really need it are at. So what does that mean? And here we go. This is where I got tested. I got tested at the Hanson Dam Recreational Center. So it's a drive-up site, right? And I get there half an hour. They give you an appointment time on a Friday. I get there half an hour before my testing time was supposed to start, which was, I think, 1 o'clock. And you find a line of cars well far away. And I was in this line of cars going through this recreation center by the time I got up and actually got tested, it was about probably an hour and a half later. I got out of there at 2. So it was over an hour and a half. So consider that. So you're sick. You're in your car. You have to have a car. You're driving. And it's a big multi-hour event going through this drive-through. And before you get there, they tell you to watch a video on your phone that shows you instructions on how to do the test. And then they give you the test in a bag, and it has different instructions in the bag. But then you actually look at the test stuff they give you, and the instruments they're giving you are slightly different. So it's extremely confusing. You're swabbing your own mouth. I had no confidence I did the test right. Then when you're done, you kind of roll down your window and throw the test in a black trash can that's sitting in the sun. So, if you believe our President Trump, the coronavirus is killed with any exposure to the sunlight. So it felt a little odd throwing, this test into a hot piece of rubber in the sun, but whatever. The results came back quickly. Negative. Great. So I called my doctor. I said, hey, my test's negative. Can I figure out what my symptoms are? Because at this point, my symptoms are actually worse. I still have them. And by the way, I still have them now. The dizziness is gone away. The exhaustion, fatigue has gone away. But I still have a slight shortness of breath that comes and goes. And I'm still coughing. And it's now, many weeks, it's the 26th of July. I've been coughing since July 4th. It comes and goes. Usually in the morning it's bad, or after I shoot this video, I'll probably be coughing because after I talk for any length of time, I start coughing. So I got the results back, called my doctor the next week. I tell him I still have the symptoms. He wants me to get a second test. So he says he calls and orders a test for me. I say, okay, fine, great, I'll get a second test. He sets it up for that week, which is now the following week, at Mission Hills Hospital, something like that. Another drive-through site, by the way, he sets it up for. So I say, okay. So I go there last Saturday, so now 2 weeks since I first started experiencing symptoms to the day. And I go there, and I drive up, and they say, nope, we don't do testing here. I said, really? It looks a lot like you have a whole apparatus for testing. They can't find my name, say we don't do testing. Fine. So I leave a message for my doctor. He calls me back. Not him, but someone there calls me back the following week. And they say, no, you were supposed to go get tested there. They tell me to do it again. And I say, fine, I'll try again. So this time someone calls me to take my license and my car type and all that. And sure enough, I went there Friday. So now it's almost 3 weeks from when I first started getting symptoms. Still having symptoms. Get tested again. Drive to the site. This one, they have you park in your car, and they give you a kit in your car, and you sneeze, and then try to blow your nose. Then you roll down your window, and someone reaches in and puts a cotton swab through your nose, swirls it around, gets your boogers out of there, and they take it. Anyways, I got the test back today, negative. So that's 2 negative tests I've had. So I feel great about that, but I still have these symptoms of coughing. I don't know what it is. Maybe psychosomatic. Maybe I worked myself up. I don't know, but I'm taking tons of vitamin C. I'll let you know how that goes. But what I've learned in this process is it's very hard to get tested in Los Angeles, even if you have symptoms. If I didn't have health insurance, because even though the CARES Act and all that says it's supposed to be free, the first question anyone asks you is, do you have health insurance? As far as getting the second test, my doctor really greased that for me, and so I needed to have health insurance. And they'll take your health insurance. Even in the first case when I booked it myself, they take your health insurance. So not having health insurance, not having a doctor is going to be a major hurdle if you try to get tested. And this is not for anyone who's not great at advocating for themselves. I really had to advocate for myself and had the time to make tons of phone calls and be persistent to even get the test. And chiefly, I really had to have a car. So although the county sites, walk-up sites, I've tried calling many of these when I was initially trying to get tested, and I either wouldn't get through, or they would just say flat out there, if you do get through on the phone, they don't have available appointments. Really, really hard to get a test. So I'm thinking about the people who don't have a car. How are they going to get tested? And what I didn't mention is when I was thinking about this when I made that second appointment, and they called me and got my license and car type. I asked them before I told them that. I said, well, what if I don't have a car? What do I do? I'm not driving right now. How do I get up there? They said, ask someone to drive you. I said, so if I don't have a car and I suspect I have COVID-19, you want me to ask my grandma, my mom, to drive me and expose them? Not that smart, right? So think about some of the most at-risk communities. They not only don't have cars, but they might have trouble just getting around. And the very limited amount of walk-up sites, there are people who are symptomatic. There are people who have COVID for sure who have not gotten tested because it is so prohibitive and difficult to get tested. I'm talking homeless people, houseless people, poor people, essential workers, which can very easily be just someone working in a grocery store, someone working at McDonald's, someone working a full-time shift at a fast food restaurant, an essential worker who has symptoms. They're not going to be able to get the time off work to invest the kind of time I put in just to figure out how to get tested and get through. So there's people who are going in doing this essential work who haven't been tested, can't get tested, and they're symptomatic, and they're going and making you your meals because they're an essential worker. The way LA, Los Angeles has set this up is very prohibitive to the working poor, to the houseless communities, to disabled people. And I realized that just from in the process of getting tested myself. One component of maintaining humanity while we ride this out and minimizing the amount of death is there has to be rampant testing. I'm talking people who aren't symptomatic being tested regularly, because that's the way we know that you isolate the people who have cases. The people who have it and are asymptomatic, they're the ones who need to be getting tested regularly. Not this BS about you have to have symptoms and you need to have health insurance and you need to have a car and you need to spend 10 hours on the phone. None of that. It should be, if we were serious, if Los Angeles was serious, if California was serious, if the country was serious about stopping this, testing along with contact tracing is the way you halt this and bring down the cases and save lives. But they're not doing that. So is it because they don't have the money to do it? Is it because they hate poor people and they don't care, really? if they're, if they can sacrifice the lives of poor people. I'd say we just have a totally callous system, and in a for-profit healthcare system, you incentivize death because it's a cost-saving thing, right? If a poor person who can't afford health insurance dies, well, that's just a good thing because they had no benefit to the market, right? So get tested if you can, but you might have some trouble with that. And I just, I spent a few minutes on Twitter. I just searched "can't get tested Los Angeles." That's the first iteration I did of it. And these are the top results. And I'm just going to show you the top results on latest. And I just refreshed so you can see me refreshed. Funny tried to get tested in Los Angeles and was told I can't till September. Why can't I still get tested in Los Angeles? This is July 23rd. Did you not do your job and single out blue states? People replying to the administration. And this is the site I just showed you. Have not met the criteria for testing. Just tried to schedule my son to take a COVID test. He was denied, which is unacceptable. You know why we can't get a handle on coronavirus? Because people who may be asymptomatic can't get tested. See, I very much agree with this person. In Los Angeles, we can't even get tested. All current and future appointments are full. So you can't figure out which is more discouraging. I really just want to understand what's happening with testing in Los Angeles because I do know it's not just me. With July 4th in our rear view, it's going to be key for folks to get tested. And I'm sure if you do variations of this, different words, you're going to find a lot of stuff. And anecdotally, that's what I've heard from other people who try to get tested. You shouldn't need a car to get tested for COVID-19. In this article is more details about, it says 42 of the 105 testing sites as of June 15th are walk-up locations. And I'm telling you, those 42 are hard to access, and they are not easy to get appointments at. So regularly check the county and state websites following the data. As if you're familiar with what's going on in Los Angeles, we are having extreme surges in cases and deaths. The hospitals are overrun. I'd say we haven't yet recovered from the reopening. So we reopened, and that's kind of when a lot of people said, phew, back to normal, and went about their lives and stopped being responsible. It's because we didn't have the honest leadership that kind of soberly takes stock and gives us the straight up of what's going on. Not only that, but people are desperate. I understand someone who can't afford rent or mortgage who says, I'm just going to go out and make my money. Or even a business owner who says, I'm not going to let my business go out of business. I'm going to keep on running it. I get that because we've been left out to dry by the government. One $1,200 check isn't going to cut it for the average person. We needed total rent and mortgage freeze, meaning pause. No one has to pay anything. We need, some countries have done like total lockdown with grocery delivery to the door. We needed that. So it's understandable that people, it's forgivable that people just go about their lives and get out there. And especially because we get incoherent, inconsistent information from people who are supposed to be leaders. I'm talking everyone from Garcetti to Newsom to Fauci to Trump. Don't forget the CDC lied to us for months, telling us not to wear masks to save them for the nurses. And the average person who doesn't have the patience to read scientific literature and doesn't even have the patience for the nightly news, they are not going to be patient enough to listen or even dig up the truth and act responsibly. They just want to go about their lives. So we haven't recovered from the reopening, and by that I mean people were told they could feel a sense of relief and go back to the normalcy of their lives. So now, even though cases are surging and there's more new cases and deaths every day, and every week we have a record-breaking day, I walk around the block and I still see the soccer park and the basketball courts full of people, unmasked, mostly young. I hear people having parties. You see people having parties on Instagram. You drive down a street and you see restaurants packed, not just outside, but people milling around inside. So we lost our opportunity through lack of testing, through lack of leadership and good knowledge. We lost our opportunity. Now we have rampant death. It's a death cult. And the capitalists that are just we're the sacrificial lambs to them. If you look at the CARES Act and you look at legislation going through, and you look at the wealth of billionaires, which has skyrocketed in this time, what we're seeing is a huge transfer of wealth and a reorganizing, a huge transfer of wealth to the top, a gutting of all the public reserves, and they're buying the average person off with a $1,200 check every couple months, or the carrot of a new $1,200 check. They're buying us off while they're selling off everything else. Here's a headline from ProPublica. CARES Act sent you a $1,200 check, but they gave millionaires and billionaires far more. You just have to look at the wealth of people like Bill Gates, Elon Musk, Jeff Bezos. You know, I had my own COVID-19 experience. I told you about it, and I learned that testing is a farce. You know, it's theater is what it is. It's a way for the mayor, the governor to say, look, we're acting responsibly. We're doing what we have to do. But it's very limited. You have to have a certain amount of privilege, of various privileges to even get a test. And Californians are Angelinos are dying en masse, sacrificial lambs to the billionaire class. We're just siphoning off the wealth, what's left of it, of this country. They're buying us off with $1,200 checks. That's not a conspiracy theory. It is a conspiracy. It's not a conspiracy theory. Don't mistake it as I'm saying COVID-19 was done on purpose for this purpose, right? But there's people who will always take advantage of any available situation, and they often get away with it because the public is asleep, and they have nothing to fear because they've been getting away with it so long. So they will exploit this situation to lean on the Senate, lean on Congress to get paid. I do say, though, I will take no vaccine supplied to us from Bill Gates. And I urge people to read this article from Mint Press News. I'll close with this. Africa to become testing ground for trust stamp vaccine record and payment system. So Bill Gates and MasterCard using West Africa. And if you remember, remember this country giving black men syphilis, Tuskegee, any number of things. They're basically MasterCard, the credit card company, partnering with Bill Gates to use West Africa as and the people there as guinea pigs. And Bill Gates has been at the vanguard of this kind of movement of profiteering off of COVID-19 since the beginning. And hey, I'll entertain if you have a conspiracy theory about Bill Gates in cahoots with the late Jeffrey Epstein to start this whole COVID thing. I'm willing to entertain it. It's always fun to entertain a conspiracy theory like that. But I'll just say this. I won't take a vaccine from MasterCard. a credit card company and Bill Gates. I'm going to pass on that vaccine. I'm not an anti-vaxxer. I'm an anti-Bill Gates vaccine.